Are you just starting a new workout routine, or did you really push it during your last workout? Then you're probably preparing yourself for the all too familiar muscle soreness to set in. So the question is, should you be using ice or heat for your muscle soreness? Let's dive in. Hi everyone, Floyd Meyer here. I am a physician assistant with a master's in public health, and currently I am working in an integrative physical medicine and rehabilitation clinic. So muscle soreness is going to be extremely common regardless of if you are some type of an elite athlete or just a weekend warrior. And symptoms can range from just some type of a mild muscle pain to being severely debilitated where you can hardly even move. So according to a review article in the Journal of Sports Medicine, delayed onset muscle soreness, or DOMS, is most prevalent at the beginning of the sporting season when athletes are returning to training following some type of a period of inactivity. And it can also happen in athletes when they are first introduced to some type of a new activity regardless of the time of year. But what exactly is causing this muscle soreness to occur? Now, there has actually been quite a lot of research on this because not only can this muscle soreness prevent athletes from being able to perform again at their exercise, it also can lead to some type of increased risk of injury. So in that same review article, they go on to say that, quote, up to 6 hypothesized theories have been proposed for the mechanism of DOMS. And these are namely lactic acid, muscle spasms, connective tissue damage, muscle damage, inflammation, and the enzyme efflux theories. However, an integration of 2 or more of these theories is likely to explain muscle soreness. So generally, this muscle soreness following some type of an acute activity is going to occur in about 24 hours. And generally, it is going to peak over the course of 24 to 72 hours, and then it is going to gradually improve over the next 5 to 7 days. And most people can relate to this type of an effect. Now, there are many different treatment modalities for this delayed onset muscle soreness. And you can use things like heat therapy, cold therapy, electrical stimulation, massage, chiropractic, compression, injections, oral anti-inflammatories, NSAIDs like ibuprofen and naproxen. All of these can be used to treat this muscle soreness. But today we are going to focus on the 2 most common and most accessible, and that is going to be heat therapy and cold therapy. Now, both heat and cold therapy are going to be part of the standard of care when it comes to treating some type of musculoskeletal pain. Now, cold therapy is going to be the application of some type of a physical medium, and this can be ice packs, ice directly on the skin, it can be cryotherapy units, it can be cold water, but all of these are going to have the goal of decreasing the temperature of the skin. And the general idea, as stated in a systematic review in the Journal of Athletic Training, is that, quote, ice is used to limit the injury-induced damage by reducing the temperature of the tissues at the site of injury, and consequently reducing the metabolic demand, including vasoconstriction and limiting the bleeding. It can also reduce pain by increasing the threshold levels of the free nerve endings and at the synapses, thereby increasing nerve conduction latency to promote some type of an analgesia. And more simply put, cryotherapy is thought to work by decreasing the tissues, and this is going to decrease your pain levels, and it's going to decrease the metabolism, which is going to lead to a decrease in the amount of injury that you sustained, and this is following some type of an acute injury. Heat therapy, on the other hand, is going to be the application of heat to the body, resulting in an increase in tissue temperature. And you can use multiple modes to do this. You can use superficial heat wraps, you can use moist heat like from a hydrocollator, you can use infrared heat, you can use hot water bottles. Multiple different things can be used to heat up the temperature of the tissues. And the physiological effects of this heat therapy are going to include pain relief, increases in blood flow and metabolism, and an increase in the elasticity of your connective tissues. And the rate of local tissue metabolism can increase by this warming, which may further promote healing. So how do these two therapies actually compare? And luckily, there has been quite a bit of research done to compare using heat versus cold therapy. So in one study posted in the Archives of Physical Medicine and Rehabilitation, they had patients perform some type of a vigorous eccentric exercise to experimentally induce this DOMS, or delayed onset muscle soreness. And so they had these participants do that, and then they split them up into two groups. So one group used a continuous low-level heat therapy, like a heat wrap, like we see here, like this Thermacare heat wrap, where you put this on the skin and it remains warm and it warms the tissues up for about 8 hours. And they compared that to the other group, which they used just a standard gel-filled cold pack, something like this, and they put this on the skin for about 15 to 20 minutes, and they did this every 4 hours. And they started doing the therapies between 18 and 42 hours post-exercise. And they said the results were as follows. So at hour 24 post-exercise, the mean pain relief score for the heat wrap group was 138% greater than for the cold pack group. They go on to say that, quote, the findings in this study that the heat wrap provided superior pain relief at 24 hours post-exercise compared with the cold pack treatment of low back DOMS appears to be contrary to the traditional practice of relieving acute musculoskeletal pain with cold pack therapy, a form of cryotherapy. Now, in another study posted in the Journal of Strength and Conditioning, they looked at the difference between heat and cold therapy, and they looked at about 100 healthy individuals, and they were between the age of 20 and 30 years old. And so what they did was they had these participants, they did bodyweight squats for 5 minutes straight in order to induce this delayed onset muscle soreness in their lower extremities. And then the participants were split into 5 different groups. So they had a control group that didn't do anything. They had a group that put on a cold pack immediately after doing the exercises. They had another cold pack group that put the cold pack on 24 hours after the exercise. They had a heat pack group that put it on immediately after doing the squats. And then they had another heat pack group that did it 24 hours later. And so they summarized the results as follows. So, and this is for strength testing, they said that, quote, the heat immediate group recovered by the second day after exercise to their pre-exercise strength, whereas the cold immediate group still showed a significant loss of strength at 3 days after their exercise compared to their pre-exercise strength. And with regards to pain, the least pain was felt at 1 day after the exercise, and it was in both the heat immediate group and the cold immediate group. But there was no statistical difference between the hot and cold groups 24 hours after exercise. So basically, the group that put on the heat pack immediately after exercise got back their pre-exercise strength the fastest. And both groups did show that you got some pain relief using both heat and cold. They discuss their results as follows. They say, quote, for some reason in athletics, it's believed that cold after exercise is going to be the best modality to prevent swelling and damage to muscle. They say that at least for this age group, this is not true. There is a definite advantage in heat after exercise if applied or used immediately. Cold and heat both prevent muscle damage, but on balance, heat is going to actually provide a small advantage over cold in increasing healing after a heavy workout. So it's looking like the heat therapy is going to be more effective for treating this delayed onset muscle soreness. But should you apply this immediately after? Should you be applying the heat, once the pain and the muscle soreness actually kick in? So one study compared the use of heat wraps either immediately after exercise or they waited 24 hours after exercise to begin the heat therapy. And they noted that, quote, the best use of heat was for 8 hours after exercise because the soreness was less and the apparent muscle damage and tendon damage were also less. Meaning that the earlier use of the heat therapy is going to provide more pain relief and it's going to increase your body's ability to heal, which is going to decrease that delayed onset muscle soreness that we get following some type of an intense exercise. Now, in most of these studies, these researchers are using the heat therapy, this continuous low-intensity heat therapy like these Thermacare heat wraps. And this is going to be a lot different than using some type of a heat pack or a heating pad or an infrared heating lamp where you're going to only, or a water bottle where you're only going to be using this for about 15 to 20 minutes. And I think this is why these more recent studies are showing a more beneficial effect to this heat therapy, especially because previous to this, when we look at older research studies, there is much more discrepancy in the literature showing, some of them show a positive effect, some of them show no effect at all, some of them say that cold is better, some say that heat is better. And I really think that the reason that these more recent research studies are showing more positive effects from heat is because they are using this type of a heat therapy versus using just some type of a infrared heat lamp or a heat pack for 15 minutes at a time. So for example, a very large Cochrane systematic review, which this was done in 2006, before any of these more recent studies that I recently quoted were done, they looked at 9 clinical trials involving over 1,000 participants, and they were looking at the comparison of using heat or cold for low back pain. And they summarized their findings as, quote, in 2 of the trials, 258 participants with a mix of acute and subacute low back pain, the heat therapy significantly reduced pain at 5 days compared to an oral placebo. And they go on to say that, quote, there is insufficient evidence to evaluate the effects of cold for low back pain, and there is conflicting evidence for any differences between the heat and cold for low back pain. So, as summarized by the Sports Medicine Review article, quote, thus cold application other than its analgesic effect provides little benefit. And by contrast, according to a review article in Postgraduate Medicine, quote, heat therapy has demonstrated therapeutic benefit for both analgesia and promoting healing in certain injuries. The thermotherapy can be used as a monotherapy, meaning it can be used alone, or it can be used in combination with oral analgesics to relieve acute back pain and muscle soreness. Now, I want to point out that this video should not be construed as specific medical advice. If you have some type of an injury or some type of a musculoskeletal disorder, I highly recommend that you go and seek out some type of a medical professional so that you can be effectively diagnosed and they can create you a treatment plan so that you can get better faster. So I hope that this has been helpful. I want to make sure that you guys are subscribing, make sure that you're following, so click that button down below so you don't miss out on any more great content. Again, this is Floyd Meyer reminding you to recover better so that you can do more.